Okay, and then they can.
Oh, like I just want to record the skill. Then, so if because I don't have consent for your voices, so I'll answer questions later, or just do the first run, then the second we'll do it again, then I'll answer your questions. I'm just recording this skill so I can match it with the book. All right. Okay. So this is an NG tube insertion. So first, if you've the first thing you want to do is do you have an order to insert NG tube? As a nurse, you should be asking yourself, why are we inserting an NG tube? What's the reason? Is it because the patient has bowel obstruction? Do they want to rest the bowels? What is the reason for the insertion? So as soon as you establish that, then you can go to your supply room. Of course, you've checked your orders and everything. Go to your supply room, gather all your equipment, because you don't want to start the procedure and stop in the middle of the procedure to go get equipment. So you go get all your supplies. So if you notice, I have my NG tubing just laying like this. It will come in the box, okay? Wait, so you have to open the supply box. This is not a sterile procedure, but it's a clean procedure. Okay. So as always, I want to go ahead and sanitize my hand. I have all my supplies ready, and I've checked my suction to make sure it's working. Okay, so you can go ahead and connect your suction. Key things is the patient. Okay, the white tube goes to the patient. Okay, and then the blue here is the vacuum, and notice that there's another blue hooked up under the vacuum right here. So you just follow the instructions here. So my suction is working. And secondly, if my NG tube is to intermittent suction, continuous suction, I want to make sure I manipulate this knob up here based on what is needed. So continuous suction or low intermittent suction. So I have everything set up, and now I have my supplies. I'm ready to do my NG tube insertion. So I've sanitized my hands, but I'll go ahead and put on some gloves. Explain my procedure to my patient, what I'm about to do. Miss Smith, I'm about to insert an NG tube. It's gonna be a little bit uncomfortable, and I'll just give you instructions what to do, and hopefully we do it as soon as possible and get it over with. It's gonna be uncomfortable, that's for sure. So I have everything situated. I have a piston syringe here. The reason I have this piston syringe is sometimes the order says as soon as you insert flush, but usually you don't put anything in the NG tube until you do an x-ray to see that it's in the right place. So you don't want to put anything there. The purpose I have this today is because I want to check for pH. I don't have the pH strips here, but I'll just walk you through the process. I want to check for pH to make sure I've not inserted it into the lungs. Again, this mannequin here, for some reason, it can only go up to 25, okay, the way the mannequin is structured. But I will show you the right procedure. You start with measurement. You get the tip of your NG tube. You measure from the nose. You go across the ear. Then you drop it down to the xiphoid above the umbilicus, right at the xiphoid process. Okay, so I'm getting about 60. And your textbook says that when you get to 60, advance again 10 centimeters. If it's an adult, if it's a child, half of between the umbilicus and the xiphoid. Okay, but we're doing an adult patient, so I'm around 60. So when I'm inserting, I'm gonna advance 10 centimeters when I'm doing that. So as soon as you get your right where you're gonna place, okay, go ahead and put a mark on it, label it, and all of that. Okay, but remember I said this particular mannequin will only go down to like 25 or 30. Okay, so just for that purpose, I'll put it around 25 or 30. Okay, so but you measure where you're supposed to go. Okay, because that's when you get there, then you know you're probably in the right spot at that point. So Now, I have lubricants here. I'm gonna open up my lubricant and lubricate the tubing, because again, remember I said it was uncomfortable. I'll lubricate my tubing here. Really lubricate this tubing very well. Okay, well, if you start advancing and you get resistance, you have to stop. So if you start like with your right side, there's resistance, stop and try the left side. If this patient has had any kind of nasal surgery, or they've had a gastric surgery, if I drop something, because it's a nasogastric tube, so we're starting from the nose right down to the stomach. So if they've had gastric surgery and I drop this to the stomach, that could cause problems, right? So do you want to get history of your patient to know if they've had any kind of surgical procedure that can prevent them from getting the tube? So if you do that history and that's the case, then you go back and notify your physician that, oh, they just had surgery to their nose. That's not going to be possible, so they can try another stuff. So I've lubricated the tube. Again, here I have a cup of ice water. Okay, if this patient is NPO, I'll just tell them when I'm inserting, I'll just say swallow. But if they're not NPO, then I'll put a cup of ice water here. Once my tube is in, if I can identify that, if I can, I'll use good judgment somewhere in the esophagus here. I'll tell them to swallow so I can drop it to go down to the stomach. That will help the insertion. So that's why I have this. So I'm ready, I'm lubricated. See, I've clamped the tube here, because if I don't clamp the tube, since we're hooking it up to suction, let's assume that this patient has a bowel obstruction. As soon as I insert it, and stomach content will start coming out and I can soil myself. Okay, so for PPEs to wear, use your good judgment. If you want to put on a gown, that's fine. Just use your good judgment. Usually if you do the right thing, you just need gloves. Okay, and they can start throwing up, so it'll be a good idea to also give them an emesis bag or an emesis basin. If you think that they can throw up, you can also do that. Okay, so my tube is lubricated. I'm about to start my insertion. If you see how it's marked, I'll start straightforward. When I'm about like 10 centimeters, then I'll drop it down. Okay, so it's gonna be a little bit uncomfortable. Okay, so then I drop until I get to where my label is. Then the textbook says go 10 centimeters. Okay, if you look at the mouth of the patient, the tube has passed down the esophagus, is going to the stomach. So while I'm inserting, I can ask my patient to swallow. If I'm getting resistance, I say, can you swallow? Okay, can you swallow? Okay. Oh, yeah. So I'm certain now that it's in the stomach, but then if I just let go of this tube, it can come out. Okay, so I'll just initially go and tape it around the jaw of the patient. I should have done my tape ready. So I'll just do my first tape here. Some of your facilities will have a securing device for that, but you can start by taping it there. Then you can make a split tape to secure here. However you choose to put your split tape is up to you. You can put it, just make sure it's secure. So my split tape. Go under. All you're doing is that you're just making sure it's well secured, it's in place. So establish that if you have a securing device, you can use that. So I'm secured, then I can now also tape it to the gown here, or just pin it to the patient's chest area, just to make sure my tube is where it's supposed to be. So, okay. Now I'll have to test for test the pH to make sure I'm not in the lungs. So never put anything on the blue tube in here. Okay, no medication, nothing. It's just nothing there. So I'll go ahead and draw back. Okay, so I have some stomach content. I test for my pH. If my pH is under 5, okay, it's in the stomach. If it's above 6, it's in the lungs. Okay, so if it's in the lungs, as the tube is not supposed to be in the lungs. Okay, so that's how I'll know I'm in place. But this is not good enough. I'll have to send this patient to go do a KUB, go do an X-ray for me to confirm the placement. So the gold standard to confirm placement is an X-ray. So I'll send this patient for X-ray to confirm that my tube is in the right place. Okay, and to take out this tube, okay, so that's the insertion part of it. So now to take out this tube, of course you want to get the order to remove the NG tube, so you can explain your procedure to the patient. And the key thing is, once you get all your tapes out and everything, you just tell the patient that of course it's going to be uncomfortable, that as once you secure everything, you ask them to take a deep breath and you just pull straight on, then coil everything